Pope Francis has been in the hospital now for about 4 days due to a respiratory infection. Now, I want to talk about this case specifically because what's going on with him reminds me of what I used to see in the ICU, which has led me to be a hospice nurse. So let's talk about it. The article starts out by saying doctors have changed treatment for Pope Francis' respiratory tract infection to tackle a complex clinical situation. Test results have come back saying that he has a polymicrobial infection, which I'll talk about that in a second. Just a side note, a polymicrobial infection is one caused by 2 or more microorganisms and can be caused by bacteria, virus, or fungus. Now, the main thing I want to talk about is how I used to see this a lot in the ICU, where someone comes in who's 88, probably has multiple comorbidities, meaning some issues with the heart, some issues with the kidneys, some issues with the lungs. And then they get this infection that has multiple organisms, which is hard to treat. So they have to use different antibiotics. And then all of a sudden they become antibiotic resistant, which means it's hard to kill the infection. So then they start going in and out of the hospital because they're elderly, they have a lot of comorbidities, and then they continue to get these infections that are hard to treat. Going in and out of the hospital debilitates them, which leads to their slow decline and eventually death. To be clear, the article does state that the Pope is stable and that he's eating in the hospital, so he has an appetite, 1, and 2, he's not on a ventilator because he's able to eat. This is a pattern that people in healthcare typically see with elderly people. The point of this video is just to help people have awareness around what decline can look like in elderly people and when to start trying to plan for things, because everyone has an end-of-life journey. We don't know when or how long, but it's getting close, right? If someone's 88, has some comorbidities, has been in and out of the hospital a lot, they still could have a good 10 years, but still, it's getting towards the end of their life. And that should clue us into, let's start planning how we want that to look. The more we plan, the better we live and more peaceful we will die. Of course, well wishes to Pope Francis.